Earlier today, we held a conference call with all local jurisdictions in the county to share information and coordinate our combined response to COVID-19 with our state and federal legislators. If we continue to work together and take personal responsibility for preventing the spread of COVID-19, we will flatten the rate of infection and reduce the impact on our local hospitals. The most effective strategies to stop this virus are simple but powerful. Remember to stay home unless you are running an essential errand or getting some fresh air in your neighborhood. When you must leave your home to purchase food or complete other essential errands, make sure you stay at least 6 feet away from other people. Please continuously wash your hands throughout the day and regularly disinfect high-touch surfaces. All these steps are necessary to flatten the curve and preserve the capacity of our local healthcare system. I'm happy to say everywhere I go, I see people and businesses getting better at social distancing. Many residents are calling ahead to place takeout orders from local restaurants. Grocery stores and other businesses have created new ways to keep people at safer distances. If you are feeling sick, please treat your symptoms at home and isolate yourself from others. If your symptoms are worsening, please call your medical provider or the public health clinics. A medical provider will be able to provide you with personal guidance to stay healthy. Local schools and most childcare facilities have been closed now for more than a week. Having previously operated a childcare center, I understand the challenges this situation presents for many local families. Our local schools and the county education office have stepped up to help children and parents. Even with schools closed, most of our local school districts have been able to provide meal services to students to make sure that families are not burdened by food insecurity during this very challenging time. Our local school districts are also implementing online learning platforms for students to be able to learn from home. Many districts, like the Goleta Union School District, are working to make technology available to families in need to ensure that all students have an opportunity to learn remotely. The Santa Barbara County Education Office and Children's Resource and Referral Service in Santa Barbara County are helping coordinate child care services for medical providers, first responders, and other service providers. Please visit sbceo.org to learn more about the services that are being offered by our local schools in response to COVID-19. Next, I'd like to introduce Dr. Henning Ansorg, Santa Barbara County Public Health Officer. Dr. Ansorg?
Thank you, Supervisor Hart. Good afternoon. Let me begin by sharing that as of today, we have 32 confirmed cases in Santa Barbara County. The ages of the new cases range from the 30s to the 60s. Of these new cases, 2 are in Santa Maria, 2 are in Santa Ynez Valley, 1 case in Lompoc, and 1 case in Santa Barbara. Of our 32 confirmed cases, 21 of them are recovering well at home. 3 patients are hospitalized, 1 of whom is in critical condition in the ICU. 8 patients have recovered. With this said, I would like to thank everyone countywide for cooperating with the social, or better said, physical distancing efforts by staying home and limiting outings and limiting physical contacts. I personally feel very grateful to be living in such a beautiful community and to be surrounded by such considerate neighbors. I thank you for that. In Santa Barbara County, we are fortunate that during this emergency, we are actually trailing behind larger epicenters of this pandemic. And therefore, we do have the opportunity to learn from their successes and also from their challenges. We do expect that very good adherence to these drastic measures of physical distancing can bring down the projected attack rate of the virus substantially. Essentially, it could cut it in half or even further down. It will also help to spread out infections over a slightly longer period of time. This is essentially what it means to flatten the curve. Practically, it will put us in a much better position to be able to take care of patients at our hospitals in case they are in need of it. It will also mean that even at peak times of viral illnesses, we will hopefully be able to meet the demand for ICU beds, ventilators, and the like. Let me repeat, only if everybody complies with the physical distancing and stay-at-home orders, only then do we have a chance to accomplish this. I urge you to comply. However, even under more favorable scenarios, let me assure you, we do not take this for granted, and we are actively preparing for even less favorable scenarios as well. We are in constant contact with our partners at the state and federal level, and we seek their help and advice in planning for more serious possibilities and options. We are working diligently at expanding in- and outpatient care options to be prepared for a surge in cases of COVID-19. Thank you all again for supporting our communal efforts in mitigating this serious epidemic. Thank you.
Our next speaker is Jan Kogler, the Emergency Preparedness Manager for the County Public Health Department.
Thank you. I'm going to talk a little bit about surge planning first, just to follow up on what Dr. Ansork said. And we are actively working with all of our hospitals in the county. They are identifying every area of their hospital that can be used for additional beds and additional care, increasing their ICU capacity, and working hard to make sure that they can maximize their space. In the event that additional beds are needed, the county is working to identify sites across the county, both Santa Maria, Lompoc, and Santa Barbara, that could house sort of step-down patients who don't require such a high level of hospital care, and that way we can decompress the hospitals. And that's a joint effort between the health department and also our other healthcare partners to staff those beds and supply them. So we're working hard on that this week. The second thing I was going to talk about, which is masks on everybody's mind. So just to review, there are two types of masks. We have our N95. This mask is worn by healthcare providers. It fits very tightly against the face, and it prevents all air from the outside from coming in. So the healthcare provider is only breathing in through the mask. The other type of mask is a procedure mask, and you may have been asked to put this on at a doctor's office. This keeps droplets, if you're sneezing or coughing, inside the mask and prevents them from going out on surfaces or on somebody else. So you might be asked to wear this in a doctor's office, or if you had somebody at home who was ill and you're isolating them in their room, when you come in the room, they may want to put on a mask so that they're not expelling those droplets in the areas that you're in. If you have somebody who cannot wear a mask, a child or someone who has difficulty breathing, you may want to wear a mask while you're caring for them, and that protects you from the droplets that they expel. So one thing about that, though, after you put it on and wear it, wash your hands first, take it off carefully, and put it in the trash, and then wash your hands again because you've touched the outside of the mask. You want to avoid, do not touch the mask while you have it on, and don't touch your face. If you have a cloth mask, like we've seen some homemade cloth masks, you can do the same with that. Again, take it off carefully and put it in the laundry on the hottest water with detergent before you wear it again. So that's what I have to say about masks today.
Thank you, Jan, for that information. That's really helpful. Our next speaker is Alma Hanabahab with the Santa Barbara County Workforce Development Board. She's the Rapid Response Coordinator.
Thank you, Supervisor Hart. We have the economic recovery information loaded on the readysbc.org website now. It provides federal, state, and local loans that are available to businesses and to workers. We also have the email address covidbiz, covidbiz, at countyofsb.org, set up for businesses should they have any questions. The economic recovery team will be responding to that. And then, we understand that this is a very long-term recovery process, and so we are definitely here to support businesses and workers as much as we can.
Thank you. Next, we'll go to questions in the room. Are there any questions? Ryan, would you mind using the microphone right there? And you can get close. It's been disinfected. Thank you.
The hospitalized number is now 3, but after talking to Cottage Health, they've said, on a typical day, they go through about 25 and 95 masks, and that recently they've been going through more than 600. So my question is, even though there are only 3 confirmed cases that are in the hospital right now, has there already been an influx of potential COVID patients that just haven't been tested? What explains kind of that shift over the past few weeks, even though the confirmed number of hospitalized cases is only 3?
Dr. Answer, do you want to answer that?
Yeah. I'm not aware of, the N95 mask usage at the hospital. What I can say, though, is because we would like to test more people, obviously. So given the national scarcity in the testing, and we are really ramping up as fast as we can, but given the scarcity of the test supplies, or the testing kits, we have to assume that anybody with a respiratory, influenza-like illness could have COVID-19. So therefore, the healthcare providers in the hospitals have to protect themselves as if they were dealing with a patient who is confirmed. And just because of the uptake of, respiratory illnesses, it doesn't surprise me that their usage of those masks is going up.
So there has been an influx of respiratory patients, just not necessarily all of them can get tested at this time?
I cannot confirm the details on that. You would have to check with Cottage on that. But what I can tell you is that, we have to assume that anybody, whether they're in the hospital or not, anybody who feels unwell, even with a sore throat, with a little bit of diarrhea, with fatigue, with feeling I am coming down with something, you have to assume you have COVID-19 at this time.
And the next step for that is stay home and treat your symptoms. And if they progress, then contact your medical provider and get additional guidance. Any other questions in the room? We'll next go to the calls on the reporters on the call.
We have no questions. I think that concludes today's
Okay.
press conference.
Thank you. We are done today, and we will have another press conference tomorrow at 4:30 in the afternoon. If you would like additional information about COVID-19, please go to publichealthsbc.org or call the call center, which is open 7 days a week from 9 a.m. to 6 p.m. The number is 833-688-5551. Thank you all for being here today.